So many thanks, Pippa, Kiels, and friends, for the most kind invitation to contribute as incoming ERS president. So first, I would like to congratulate you, all of you, for organizing this ELF Patient Organization Networking Day. What I've seen and listened to is a great success with a lot of engagement and very, very well done. I'm very, very proud of you. And I feel that the theme of this year is very timely, of course, at least in part because of the COVID-19 pandemic. But beyond that, we all know that technology is ready for sharing more and more. And we have to put some safeguards, of course, because it's maybe too ready sometimes. And awareness among patients and healthcare providers and carers is present. So clearly, you have had great presentation today. Anita Simons, who has put her presidency on digital health spotlight, has given a great address, and many stakeholders have shown us how digital health is fast developing to assist us, not to dominate us, but to assist us and give us some tool to interfere, to work together, to waste less time in traveling and have more time to interact. Of course, face-to-face meeting is important, but we can also secure some time thanks to technology. So I hope that you have enjoyed this digital event day and that you have new ideas for yourselves and for your organizations. So on a personal note, I have a great interest for all aspects of respiratory medicine, ranging from basic science to clinical medicine, including common and rare diseases. And I think, as Pippa said, rare disease, it's my signature, my flavor. But I work a lot in common diseases, in severe asthma, in COPD, etc. In intensive care units, respiratory intensive care units, it has been extremely common this year. So we have had a lot of work. But of course, rare diseases represent something I would like to privilege, because these rare diseases have long been called orphan, but they are no longer orphan. And that's a word we don't want to use anymore. They are rare. So they are like diamonds. They are rare, but they deserve a lot of attention. And I will, of course, support ELF and Patients Initiative in all areas of respiratory medicine. And the strong links between ERS, ELF, and Patients Organization will be my priority. And as you mentioned in your introduction, I'm the vice coordinator of the European Reference Network for Rare Lung Diseases, called ERN Lung. Many of you, and I see some names in the chat, are very active in that field. And you can count on me for ERS to be very, very committed to its pillars, education, research, advocacy, patient support in the field of all aspects of respiratory medicine, but including rare lung disorders. So what I would like to do, and we have already started that, we will support clinical practice guidelines with patient involvement. And I think that Gergely is present, Gergely Messeros is present today. And clearly in the clinical practice guideline, I try to organize, there is 10% patient representation. So not one, but rather 2 out of 20. And with gender balance, country balance, equity. So we try to be inclusive and try to be open. So clinical practice guidelines, it's not digital medicine, but for those of you who have been part of recent guidelines, everything has been digital. We have not had a single face-to-face meeting. Everything has been virtual, but with great commitment. And I've been involved in guidelines for many years. At the first time, I see 100% commitment at all meetings. So usually it's 70% commitment. So on this occasion, it was perfect. So that's something positive. As you know, we also have clinical research collaborations at ERS level. These are very important tasks, and patients as well as healthcare providers should be part of this clinical research collaboration. In rare lung diseases, you have clinical research collaboration on bronchiectasis, and I know how successful you have been with your patient bronchiectasis day, and well done for that. We have that also in pulmonary hypertension, in interstitial lung disease, and of course, cystic fibrosis and other conditions are great priorities for us. So we will also have dedicated programs, and I try to think about new ways to understand rare lung diseases thanks to new online registries filled by patients themselves. And I've heard a few minutes ago very good feedback about registries, and you may know, I'm sure you know, and maybe you have mentioned it and I missed it, but the European Reference Network for Rare Lung Diseases has introduced a patient population registry. So if you wish, I can put the information in the box. I think you can see it. And it is a population registry. And honestly, I think it is a very good initiative from the leadership of the ER and Lung. And I wish ELF to be very strong, a key partner of that. And I think Kjeld and Pippa and others, you have been directly contacted maybe, but maybe not enough time to interfere, but I have contacted the French organizations, the PHA Europe, etc., but CF, etc. All the rare lung diseases should be aware of that. The willingness to contribute is not mandatory, of course, but it's good to have. And you know, I see the clock running. So the key message from ER and Lung, it's a political message. It's from the European Commission. It is the expertise travels, not the patients. And the patients may travel if they wish or if it is absolutely needed. But expertise is easier to share. And with, you know, clinical platform, virtual meetings with people from Eastern Europe, Western Europe, France, UK, etc. I mean, we can provide with digital tools an outstanding support for patients to be considered next to their home and together with their local doctors. Even if local doctors are not, you know, the most famous in the world, they may be extremely committed to your condition, and they may wish to discuss your case with one of us. And this can be done virtually. And if by any chance your condition requires, you know, face-to-face meetings, we can organize that. And to the European possibilities, you know, we have possibilities to cover expenses for European expertise care. So we can share a lot. We have priorities. And I would really like in my term, you know, it's only 1 year term, but I've been around for a long time, as Pippa said, and I will remain after. But I would really like patients to consider the ER and Lung as their home. And even doctors still have to work a bit because, you know, it's very bureaucratic. You know, European is always a bit bureaucratic, but with people like me and people like you, we can put some flesh in it. We can put some personal communication and use the tools for what they are, only tools, and share the expertise and do it for the benefit of the patients, their families, their friends, and the countries where they live. So I will not speak more, but thank you so much for inviting me. And I really hope we can work together closely, and I wish you a very nice end of the day and conclusions. Thank you.